No, we're
Yeah,
good. I marked it down on the agenda, 9:04.
That's okay.
Yes, I'll be glad to do introductions. We'll
Thank
start
you.
with committee members and Melissa.
Okay, Melissa Van Hook, Chair. I'm obviously present.
Thank
Something like
you.
that.
Jana.
I am here.
Thank
Good morning.
you. Good morning. Thank you. JJ.
Morning, everyone. JJ Rico, Vice Chair.
Thank you, JJ Fichette.
Good morning, I'm here.
Thank you. And then Monica, we have her by phone.
Yeah, I'm here.
Thank you. And then staff, John.
This is John Myers, Executive Director.
Okay, Lonnie.
Good morning, everyone.
And then me, Marcy. And I don't think any other staff are joining us.
No, I don't know if you want to note it. Mike and Jason are staffing our table at the American Indian Disability Summit. Sarah is out of the office on a personal day today.
Okay, that's it. Back to you, Melissa.
Okay, thank you so much. Let's move on to agenda item B, our minutes review and approval for our January 12th, 2024 Executive Committee meeting. As per usual, I hope everybody had a chance to review those minutes. Are there any comments, questions, or necessary corrections anybody needs to make? Okay, hearing none. I'm going to call for a motion to approve the minutes for the January 12th Executive Committee meeting. Do I have a motion?
So moved.
Thank you, Monica. Do I have a second?
JJ
This is
seconds.
Michelle. I second it. Oh,
JJ just beat you. Okay, thank you there, both of you, but thank you, JJ. All those in favor of passing, please say aye.
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 All those, thank you, Jana. All those opposed, please say nay. I don't think there were nobody not voting. Okay, motion carries. Thank you so much. We will move on to agenda item C, our fiscal contract updates with Lonnie.
Are you guys looking at the ADDPC financial update?
Yes, we are.
Perfect. The council has received the full allotment for fiscal year 2022 in the amount of $1,500,930. This is level funding to fiscal year 2021, excluding the Puerto Rico reallotment. ACL has granted a no-cost extension for fiscal year 22, extending the project period through September 30th, 2024. The council has fully obligated these funds and will need to complete the work by this September. There's approximately $23,171 remaining to be liquidated or spent by this September. The council has received a third allotment for fiscal year 2023 funding in the amount of $398. This brings the current fiscal year 2023 total amount to $1,501,328. The council has fully obligated these funds. The obligation and period of performance requirements are both through September 30th, 2024, so this year, with the final report being due by September of next year. The council has received the third allotment for fiscal year 2024 in the amount of $200,476. This brings our current award amount to $711,770. The obligation and project periods are through September 30th of 2025, with the final report due September 30th of 2026. We have not received the final award for fiscal year 2024 yet, but it should be coming soon and it should show us at level funding. So the estimate should become actual once we receive that final award letter. Any questions on this sheet? Okay, moving on to the COVID funding. The first is the access to COVID-19 vaccine funding. The council received an additional award in the amount of $84,288 for COVID-19 specific projects. ACL granted a one-year no-cost extension for these funds. The funds needed to be obligated and were completed by September 30th of 2023. The final report was due by the end of January of this year, and it was submitted. The council spent $82,809 and has reverted a little bit more than what I was anticipating, but $1,479 was reverted. This will be the last time that you see this. Final reports have been submitted, so that's kind of the end of the COVID-19 vaccine funding. The next one was funding to expand public health workforce within the disability network. We received $95,319 for this work. The funds are being tracked and reported on separately. The obligation and project period are through September 30th of this year. However, the contract for this project has concluded, and the council has received and paid the invoices for the full amount of this award. So all $95,319 has been spent on this project. Any questions on this sheet?
Lonnie, this is JJ. Maybe it's a question for John. John, are you all needing more money to work on the project? We have some still, as you know, we receive the same funding, and so we're still spending hours and just obviously want to support one another if there was a need for additional funds for any work that you guys were working on in this project.
You know, at this point, we don't anticipate there's going to be a need for more money. This project, as I've shared in the past, was essentially comprised of a contract with the Sonoran USAID and a subcontract to the Regional Center for Border Health in Yuma to do a series of focus groups and issue a report on the needs of individuals with IDD who are aging in communities around the state. And so all of the expenditures have gone to that contract. It is entirely possible that we may find a need for some additional funding between now and the end of September, but we don't have any idea what that might be at this point. I appreciate the offer, and if something like that does arise, we'll be in touch.
Sounds good.
Thank you.
You're welcome.
Thanks, guys. Any other questions on the COVID funding? Okay. Moving on to the council funded projects. This sheet shows all the current projects funded by the council. Not much has changed here from our last meeting. We're just following up on any outstanding invoices here. And due to timing, some things may have processed that aren't showing on this sheet yet. Any questions on the council funded projects? Okay, moving on to the final sheet. Sorry, this is so small. The sheet reflects the projects outlined in the fiscal year 2024 work plan, as well as the funding that has already been approved in the prior years. Fiscal year 2024 funds will be used primarily for projects to be decided on for fiscal year 2025. Currently, there's a small anticipated shortfall here of $17,672 for fiscal year 24 funds. However, there are several new RFGA projects that have not been funded yet, and this leaves some flexibility if the council is unable to award these projects at the level that they were budgeted for, or if, let's say, projects that are awarded don't spend their entire amount. Also, with many of these projects starting late, we will probably, hopefully, have some fiscal year 25 funds to where things can roll over should we see that this becomes an issue. Any questions on this sheet? Okay, that's it for me. Thank you, everyone.
Thank you, Lonnie. Okay, agenda item D, our executive director report with our illustrious leader, John.
Don't oversell it, Melissa.
Come on.
Good to see everybody this morning. Thanks very much for taking the time to be on the call. First thing, just kind of tagging onto what Lonnie was sharing about the COVID-19 report. I just, kind of explained again what it was for. With regard to the report that is coming out of that, the Regional Center for Border Health submitted a report back in late February, I think it was, maybe early March. It will come as no surprise to any of my staff members that I had, I asked for some significant, I guess, revisions or edits to that report to improve clarity, to clear up some just some issues. But we're waiting on a final report. We're waiting for them to resubmit with the corrections that that we requested from them. I anticipate that that's going to be coming in fairly soon. I did get a message from them last week that that they were just finalizing those things. So we should have that report. And to repeat something that I know I've also said in the past, and I apologize for that. The results of this report are going to inform the work of the System Access and Navigation Committee in its efforts to improve services to the aging IDD population around the state. And that leads me into the next item on the agenda, which is the Bridging Disability and Aging Community of Practice. I have mentioned in the past that we had submitted a request or an application to become part of this national community of practice that's being funded by ACL and that's being administered by the National Association of Councils on Developmental Disabilities, which of course is our national membership organization. We were approved to join that community of practice. We got word in late February that we were approved. We will be having our first coalition meetings next week, I believe it is. Yes, next week. So that community of practice, the Arizona, what they call the State Alliance team, will be beginning its work. Currently, we have representation from Sonoran USAID, from Institute for Human Development, from Disability Rights Arizona, from the ARC of Arizona, the ARC of Tempe, the Native Center for Disabilities, which is part of the Sonoran Center but has some separate staffing, Division of Aging and Adult Services, Division of Developmental Disabilities, and a few other agencies. Gabby Orozco from Ghane, from Ideal Care, is going to be joining us as well. We are certainly looking to grow that group to have broader representation from around the state. Right now, we're currently a little concentrated in urban areas. We need better rural representation. We also, despite the fact that Gabby is on the committee and that we have folks from the Native Center, we also realize that we need better ethnic and cultural representation. So we are asking the current members to help identify other organizations or other individuals who could be part of that. Several people have come through with suggestions. Mary Slaughter is going to serve on that committee, and she's been having some conversations with folks who work in hospice. And so we're going to be developing that as time goes on. I would point out this community of practice comes with a little bit of funding, but not much. It's a $5,000 a year grant. The really fundamental purpose of that funding is to help ensure that members of the State Alliance team can get to meetings, whether we have those meetings in person here in the state of Arizona or the annual meeting that'll take place in July of each year, just prior to the NACDD conference. This year it'll be in Washington, D.C. Next year, I don't know exactly where it will be, but wherever the conference is held, that's where the Community of Practice annual meeting will be held as well. We're very excited to get moving on this. It's no surprise to anybody that the issues around aging and disability are really critical, and that our systems, generally speaking, are not well suited to serve an aging population. So we're looking for ways that we can improve coordination, improve collaboration, and ultimately bring about some changes to the system so that the redesign is put in place to make sure aging people with IDD continue to live a high quality of life in their later years. So we're very excited about that. If you or anyone you know, or if other organizations you know of might have an interest in being part of this, it is not a horribly time-consuming project. We're probably going to be meeting as a state team on a quarterly basis. There may be some subcommittees that are formed that will meet a little more frequently, but we are looking for broad representation. So please don't be shy about submitting your name if you're interested in participating, or connecting us with other organizations that have an interest in this area and could support the effort. Regarding council vacancies, I cannot tell you how pleased I am to report that the Office of Boards and Commissions has finally appointed or reappointed almost all of the people who would be filling council positions or continuing in their council positions. We at last had formal representation from the Division of Aging and Adult Services, Raina Sims, who was nominated by Molly McCarthy, the then leader of DOS, in August of 2022, finally got approved. We now have a new representative from the Department of Health Services, Jesse Barbosa, who's worked very closely with a lot of our organizations throughout the pandemic. She's now going to be the DHS representative. We are still waiting for somebody from the Department of Education, although there has been a nominee submitted. We have a number of longstanding council members who have been reappointed. I'm sorry to say that Monica is still one of those people whose term expired. She had submitted her information, but the reappointment hasn't come through. The great thing is that state law says she can continue to serve as though she's been reappointed until the formal word comes through. So thank you for your willingness to do that, Monica. And,
Okay, yeah.
and I will let you know when the final 2 or 3 individuals are formally appointed or reappointed. But it's good to know that we now have the paperwork, we have the oaths of office submitted, we have everything in writing from the governor's office that this one set of folks has been put in place. So it's a good day. It took us long enough, and I know you guys are frustrated, and we've all been frustrated, but it finally has come about. I want to touch a little bit on the calendar of dates or calendar of due dates for our ACL documentation. And I'm doing this because some of the dates have changed and some of the things that we understood to be the case have altered a little bit. I'm actually maybe going to ask Marcy to provide a little more context, but in the packet of materials that was sent to you, there was a calendar of due dates for ACL. So, Marcy, would you mind providing a little more explanation on the changes that we're looking at and what is due when?
Can someone pull it up? I think it'd be easier because there's actually a couple points I want to cover for the next.
Yeah, I'll work on pulling it up for you.
Thank you.
Thanks.
Yeah, so the feds did, we had inquired with ITAC about a couple of upcoming dates that didn't make sense to us. And lo and behold, like a day or 2 later, they were like, yeah, we're working on it. We realized they made a couple mistakes. So pull the next page up, and if you could blow it up a little bit, that's the page I want to focus on. So there's a couple of dates that are in bold. So that's what we're targeting right now. The first one says state plan amendments. That's only for councils that make significant changes to their goals, which we never do because that requires a 45-day public period. So we can make changes to our objectives, to our work plan activities, which we've done in the past, and have, work with the work plan committee on what those changes would be. Our objectives are good. When John started, he reviewed everything. We tweaked a couple of the languages. They're still the same, but we made them more consistent on what the work is. But the activities is what we really focus on to make sure we're on track. So that doesn't apply to us. The second does, which I'm happy because this will be an easy fix. We update to the feds who the staff are. We had Sarah added on. So we'll update Sarah, our member rosters, thank goodness, because that's one of the things that we get nicked on from the feds is our council membership roster. So now we'll be able to upload all the current rosters and what categories they fit to make sure we're in compliance. And then Lonnie will update the projected 2025 council budget. So that goes in June 21st. The system where it says Verity will open up this May 28th. So we have a couple of weeks to get that in. And my goal is to make sure that it's in by or before the 21st. So that's an easy fix. What we're working on now are the next 2. And I think in our previous meeting that Lonnie had about where we were with budgets and what we need to forecast out and what we need to get solicitations for is the next one, which is due August 15th. We have to submit the 2025 and 2026 annual work plans together. So 26 is basically a copy of 25 because later on, we'll resubmit 26, what actually is going on and happening. But 25 is really crucial because we're gonna be meeting as a staff to go over 24 updates and look at what's carrying over to 25 what's new that we need to put and list it as an activity under the goals, and then make sure that's pretty tied up. And I know John will be discussing that in terms of informing the work plan committee and the council what we're submitting in. But we have some time in the summer to work on that, and hopefully have an executive meeting to review 25, or however it's going to happen before August 15th when it's due. So that will be a lot of work. So that's all the work plan activities, your outputs, your outcomes, your measurements. So that will take up some significant time from staff to recreate. And really it's 25 what I'm focused on. 26, like I said, would just be a copy for the most part of what we go in. Scrolling down further, you know that PPR, the big program performance reports, due December 30th. That's going to be for fiscal year 24. So that will wrap up this October, or excuse me, this September 30th is the end of the fiscal year 24. And then we'll work on the last 3 months of putting that report together. And then the public health workforce report, John will submit that in by December 31st. That's the work that he just reported on with the regional behavioral health in Yuma. And then scrolling down further, if someone can scroll for me, August 15th, 2025. Okay, so what I want to get your ideas and head wrapped around here coming up next year. State plan amendment, August 15, 2025 is not applicable. We don't make any changes to goals. And then we have a PPR on December 30th. So those are two things that we'll just focus on PPR. But come 2026, if you look at this new plan update, August 15th, 2026 is your next 5-year plan to be submitted. We really need to start thinking about, and John, Lonnie, and I have had some very preliminary discussions about what's it going to take to put a new 5-year plan together, so that you start working on it now and putting an outline together of all the different requirements and steps. There's a huge data collection that has to happen. And then there's creation of your annual work plan. So how many goals, what are your objectives, what are the activities? And you have to get public comment and public review. So, we can't wait till 2026 to put this together. You got to start working on it, at least get an outline together this year. And if we have to subcontract out the work, we need to think about who that's going to be, and then how public forums, public input is going to happen around the state, development of your new work plan, what you want to do in the next 5 years. But what's submitted is your first 2 annual work plan years plus all the data collection. So that goes in August. So, we kind of have to do 2 things at one time, finish up and do a lot of activities this year, but also being mindful that we have a next 5-year plan to do. So just want to point you guys out to that, because we're going to really need your assistance on how you want to guide this work with staff. Questions? No. Okay. John.
Thank you very much. I really appreciate that. There is a lot going on, and we are reaching that point. We are midway through our current 5-year plan, so we absolutely have to start thinking about the next 5-year plan. And there is a lot of work to do alongside the work that would normally be done. But we will be addressing that with the work plan review committee. We welcome input from all of you as executive committee members. We can't put a plan together if it doesn't reflect our ideas as well as your ideas, as well as the ideas of the public throughout the state. So we need a collaborative effort, and we look forward to working with you on that. Thanks for providing the other information as well, Marcy, on the other dates this year. We will, of course, keep you informed as we approach those dates, and as the reports and the updates to ACL are prepared and submitted. The last item on my report is just a mention of the 2024 Disability Policy Seminar, which we just returned from. Mike Leva and I represented the DDPC staff. Vijette was a representative from the council as well. Really appreciate Vijette making the trip. We had representation from the ARC of Arizona, the ARC of Tempe, Aries, which is a service provider here in the state of Arizona, and a couple of other organizations. The Sonoran, you said, and the Institute for Human Development, all were represented among our Arizona contingent at the DPS. I think I've explained before, DPS includes a couple of days of seminars and updates on key disability-related issues, and then a day of visits on Capitol Hill. We did that on Wednesday. We had great fortune in getting appointments with 10 out of our 11 Arizona congressional officials. We had a chance to meet personally with Mark Kelly. We had a chance to meet personally with Kirsten Sinema, and then we met with staff from the other offices. The only office we didn't meet with was Andy Biggs. We attempted to get an appointment, but we never got any contact back from his office. So, be that as it may, we were able to have appointments with the other 8 House members, and they were very good appointments. The staff were all very receptive, very interested in hearing what we had to say. We shared a variety of information about some of the topics that were developed by the DPS organizers, as well as some topics that are central to us as individuals or central to us as the Arizona DD Planning Council. I said it earlier, but I really want to commend Vijette for sharing her personal story, her lived experience as a parent of someone with a disability, as someone who has experience working with others with disabilities. That is really powerful information, and Vijette, you are just an amazing spokesperson for this cause. So thank you very much for attending it. You will see some photos in the newsletter that was just sent out this morning to prove that we were actually there. And we will look forward to next year's event, which will actually be the same week in April next year. And obviously are entertaining interest from council members who would like to participate in that and would like to attend. So we'll have more on that as time grows closer, but it was a very good event, and we were treated well by our congressional delegations. I'm really pleased with that. So that's it. I'm happy to answer any questions anyone might have. Otherwise, Melissa, I'll turn it over back to you.
I'll just quickly comment and, thank John and Vijette for doing that. And Vijette, if you haven't, had that experience before, I mean, having that much FaceTime with folks is difficult. So congratulations on that. Andy Biggs isn't always responsive. So, I mean, not a huge loss. Those are my words. But for the others, sharing that personal connection really kind of sits well with the offices and those kind of things. So I appreciate you all doing that. I'm not going to get to do that this week. I'm going out to DC and try to do that, but that's a great accomplishment that you all were able to meet with some of the offices. So I want to thank you for doing that. And FaceTime with the actual senators is also sometimes unheard of. So that's a great thing as well. So thank you for doing that and representing the council in Arizona well.
I second all you just said, JJ. It's the truth. So thank you for making the time to go. A couple things. Thank you, John, for that. Just a note, I didn't want to interrupt you, but when we do have an updated council roster, can you please just shoot one my way? Thank you. I'd appreciate that.
Absolutely. Yes.
Thank you, sir. And so our agenda item D on here is our behavioral health and crisis response survey. And hate to do this to you, John, but I'm going to ask you if you could discuss that. I was out for our last meeting when we met with our consultants that actually put the survey together and put it out. I was unable to make that meeting. So I'm going to hand this to John for a moment, please.
I will gladly cover that, and I'll try to do it briefly because we're going to provide you all a copy of the results that were shared with us for next week's full council meeting. So I won't go into too much detail right now, but I will say we were very pleased with the results we got. We know that this was the first effort, that this was the first time the council and I think really the first time in the state that a really comprehensive effort has been put into getting information from individuals with disabilities and from caregivers about their experiences working with the behavioral health and crisis systems in Arizona. We know that the survey wasn't perfect. We had lots of discussions prior to it going out. We did the best we could to make it a good, useful survey, but I don't think there's such thing as a perfect survey. We wanted to gather some general information, which we can then use to take the next step in finding more, in finding people who are willing to share more specific information, and use that as part of a process to improve the crisis response system in Arizona. But I guess what we would say is we had almost 200 responses to the system, or to the survey, which we thought was fantastic. It gave us a tremendous amount of information about how people feel about behavioral health and crisis response in Arizona, the challenges that people are facing, the obstacles that stand in their way, some of which are obvious to anybody who's tried to use behavioral health or crisis response, some of which are a little more nuanced, and some of which were frankly a little bit surprising. But you'll see when we send the report out that the information we got provides us a fantastic foundation for building on systems change recommendations, for building on proposals to support better behavioral health and better crisis response in the state. And one of the new appointments to the council I didn't mention, but you may know her, or you may have seen her on our last council call, is CJ Loisel at Access. CJ was actually responsible for the 988 system rollout here in Arizona over the course of the last year and a half or 2 years. So through that process, we've had an opportunity to educate her and some of her colleagues about the need for better crisis response related to people with IDD. Now she's going to be on the council, and I think that gives us a great opportunity to work with her even more to improve that system. So, this was a first step, but it was a very important first step, and the information we got is really going to inform the efforts we take from this point forward. The presentation we got from Noble Predictive Insight, which is the company that did the survey, was quite insightful for an organization that doesn't specialize in IDD, but one that fortunately has worked with the Division of Developmental Disabilities before and has done work with Access. They were pretty sharp. They managed to really make sense of something that isn't necessarily in their wheelhouse, and to then explain it to us in a meaningful way. So if we decide at some point we would like Noble to come back and provide an additional presentation, they are willing to do that. The contract is over, and we've paid out all we owe on that contract, but they are willing to continue to work with us. And I would anticipate, I don't know exactly what it's going to look like, but I would anticipate that if we're going to do further surveys, or we're going to do further research on this, they would be a very good source for us to utilize in the future. So I know that I jumped around a little bit, and that's a very general overview of what we got, but it was valuable information, and we'll share the more specific details through the document that we put out for you all for next week's meeting.
Thank you, John. I appreciate that. And I do agree with you. I think it was worth the time. There is no perfect survey, but I think we did get some really valuable data back. Reinforces what we know, but there's a few extra things in there too, in addition. So thank you very much for that. Okay. Agenda item F, our legal options manual update, the proposal for review, and that will be with John and Marcy.
Okay. In your packet for this meeting was a rather brief proposal to do an update to the legal options manual, which is, bless you, Melissa, which is a document that was last updated in 2016 using funding from the council. I think there have been several iterations of it. JJ, you, I think, have been part of that process over the years, so you probably know better than I how many versions have been done, but the last version was prepared in 2016. So as you can imagine, there's a lot of information that is out of date. There are a lot of documents, there are a lot of forms in there that have the names from prior administration. There are just a number of updates that need to be made, and some new information that needs to be added. The one that most especially comes to mind is information about supported decision-making, since that's now in statute in Arizona, and was not obviously back in 2016. So we requested a proposal from the Sonoran USAID and Disability Rights Arizona, formerly ACDL, to undertake an update to the legal options manual. We have that proposal in front of you now, and we are looking for council approval to move ahead with that project. As you can see, there's a timeline for completion. We would very much like to complete the project in this federal fiscal year, which would be by the end of September. But as you can see, the timeline actually goes through November of this year. It's certainly no problem if it takes that long to do it. We understand there's just a lot of work to do. So you can see the timeline covers about 7 months. We you know, we as a council will have some involvement, especially at the later stages. But primarily the work will be done by Disability Rights Arizona and the Sonoran USAID. Can you scroll down to the next page? You can see the budget, the commitment, the investment from the council would be about $21,300, a little less than that, with a match, and the total project cost is about $28,000. Next page. I won't go through all of this, but in reading this, you can see the staff who will be involved, the contracted services, subaward to Disability Rights Arizona, and so forth. And that is essentially the substance of the grant proposal. Now we can do this because we have this flexibility with the Sonoran. You said we can do this from what's known as an ISA or an interagency service agreement. I believe that's what it's called. And so we can just do a direct contract with Sonoran Youth Ed, and they can subcontract with the RAD to do the work that is outlined here. We as staff feel very strongly that this update needs to be done, and it needs to be done soon. This is without question the most requested document we get, or the document that we get the most requests for at the council. And we get requests from other organizations, including the Native American Disability Law Center and provider organizations and other advocacy organizations for copies of this report. And the best we can give them right now, of course, is the 2016 version. But given the number of requests we get and the imperative, I think, to have updated information available whenever possible, we would like to move forward with this project, and we would like council approval to take that step. Marcy, did you want to add anything? I'm sure there's something I've forgotten from the contracting side.
No, once it's approved, I'll create an ISA, so an interagency service agreement between us and U of A for the contract period, and just confirm with JC on the timeline. So that's it. So it'll become effective upon signature through the end of November, or just make sure, she could complete it without needing a contract extension through November. So maybe it might go through December, just give them an extra month. Shouldn't delay anything, because if they get it done sooner, great. But if they need an extra month, they have it within the contract instead of me issuing out an amendment. So I'm still working with JC on finalizing a signature on the budget. So that's one thing I do need from her, but that's it.
Yeah.
Thank you for covering everything.
Okay. And then JJ, given the fact that you will be one of the people involved in this work, is there anything more you'd like to say?
No, I mean, I would echo that it's for us as well, very requested. And I actually just looked at an intake where we sent it out, but kind of referenced that things were out of date. So then sent a link to kind of a new power of attorney form. So we've been trying to hold it together that way, internally. And so we're prepared and excited if this is approved to begin working on it. And then regarding supported decision-making, I mean, I think John and I and the rest of you probably have talked to friends, family members, community members who are, wanting that as an option, and even potentially looking to explore, changing from one form to another, which I think is going to be, the next challenge that a lot of individuals and families are going to be trying to accomplish. And so I know our manual won't go that in depth, but hopefully we can avoid that. I mean, again, on a personal note, I just went to my son's IEP meeting on Wednesday, and they're like, well, he just turned 17, and they once again said, oh, well, you better start thinking about guardianship. And it's sometimes interesting. I don't think they all know who they're talking to, but so I said, we're going to work on a supported decision-making plan for our son. And some of the teachers knew about it, some didn't. And then I brought up the manual, and right away they're like, well, send us a copy of that so we can start sharing. So I think it's so important that we get up an updated manual as soon as possible for those of you who've been, thinking about or have guardianship for children or family members. I mean, this supported decision making is great as an alternative and as an option. And so again, I support it. Obviously, I can't cast a vote on it, but I do think it's timely, and we'll get moving on it quickly. I know Sai's already getting some things ready. If it's approved, if it's not, then ultimately we'll just kind of have to take it on ourselves. But I think with this partnership, it'll be great, and we can get it out quickly.
Agreed.
Thank you very much for that.
Sure.
And I apologize. This will be on the agenda next week for a full council vote. I don't recall exactly what the process is. Does the executive committee need to give its assent to do that?
Yes,
Okay.
we have to vote, and then it'll go to full council next week. And it is on our agenda for next week's meeting, for full council vote. Okay. Well, if you're ready and have nothing further to add, then I am going to call for a vote to approve the legal options manual, the review and the update on that. The update specifically. In the amount of $21,278.72 to have a motion to approve the funding for the update.
I make a motion.
Thank you, Jen. Thank you, Jana. Do I have a second?
I'll second.
Thank you, Monica. All those in favor of approval, please say aye. Aye.
Aye. Aye.
Okay. And Bijette, you can throw a thumbs up or thumbs down on the screen if your sound went out. That's an aye. Okay, thank you. Aye as well. Any nay votes? Anyone abstaining?
JJ abstains.
Thank you, JJ. All right. Thank you so much. Motion carries. Okay. Moving on to agenda item G, the status of our current grant and contract solicitations with Marcy.
Okay, so quickly, just want to cover three things going on this spring. Conference sponsorship solicitation closed. There are 10 applications that the evaluation committee will be reviewing. In fact, they're meeting this committee Monday to discuss their input with staff. So we should be having that ready for the full council meeting in June to make a determination on those. The next solicitation is the Internet Safety and Training solicitation, which is available right now. It is due on the 25th, and there's $100,000 available for multiple awards. And when that closes, also we'll be looking at the evaluation committee to review those proposals and have that ready for the council in June. So that is currently out right now. The next one is a draft scope of work that John and I are working on for that's under the safety goal for abuse prevention, recognition, reporting. It's something that the ARC of the US had a contract with for 2 years. And then we decided not to award them a third year. We were going to take it in a different way, a different angle. So we're still kind of working on the scope of work, finalizing it. We haven't made a final determination on the dollar amount either, and how many awards will be made, if it's a single or multiple awards. So there are still some details that need to be worked out, but that should be hopefully finalized in the next couple of weeks to have that released in June. So that's out in the summer, and then the council can make a determination on any proposals that are selected for an award in September. So those contracts will begin in October. So just trying to figure out with Lonnie on a couple of details and with John to work on that. And that is that's basically it on my plate. There is some renewal applications that are out right now, and those are coming in at different times. So there is the support decision-making renewal, the self-advocacy renewal application. Those are both with the ARC of Arizona. So those are in the midst of being written by the applicant for a second year. There's the pregnancy and parenting grants. There's 3 of those with the state universities in Arizona. Each one of them wanted to apply for a second year. So those will be coming in as well in early May. And then we received from NAU their proposal for assistive technology. That was something in our work plan for the last 2 years. We've been having discussions with Kelly back and forth on what that would look like and what that would mean. And I think we worked out something where it may benefit the CIPC students. The CIPC was the proposal that the council funded for 4 years to provide college experience and support for students with IDD in Northern Arizona. So there may be some benefit for some of the CIPC students to benefit with additional AT. So that proposal came in earlier this week, and staff will be reviewing that to see how that looks and ask Kelly to provide any clarifications. And am I missing any other ones, Lonnie or John, on renewals? I think that's it. I know there's probably the conference sponsorship grants right now that are going on. Those end in June. Most conferences are taking place this spring. That's why you probably see some of the budgets like they haven't spent anything. But that's basically it. I think on my plate, it's just renewals and new contracts going out this time of year. Okay.
Thank you so much, Marcy. And Kelly's with us. Kelly, you probably noted this. Marcy Kelly did join.
Oh,
us.
I didn't see she joined. So
about 9:24 is what I noted. So hi, Kelly. Good morning. Okay. Well, if there's nothing to add on that, then let's move on to item H, our full council meeting agenda. And thank you, Marcy. I know you guys are super busy with all that. Okay. So our full council agenda, it looks similar today, except that we have added, thank you. You're going to pull that up for me, John. We do have our committee work group report outs, and then a little lower down on that, if you could please go down. We do have 2 presentations. Please note that the council meeting is extended an additional 15 minutes this time to 12:15. IHD will be presenting on SIPC. They're supporting inclusive practices in colleges. And then Sonora and USAID, never get their name right, guys. They'll be presenting on elevating the refugee perspectives about access to disability services on that one. So I'm looking forward to hearing both of those. So this is our full council agenda. Okay, any questions on next week's agenda?
I just wanted to say, Kelly, if Sakinya will be joined by anybody else, please let us know so we can add that name to the agenda. I wasn't aware of anybody else who would be presenting with her, but there could be. And if anybody has additions they want to make to the agenda, if there's important information that you think we should include, please let me know. All this information will be posted on Monday. So if you could let me know between now and then, that would be great.
Okay, thank you, John. This is Kelly, and my apologies for getting on late.
No
No,
problem.
it's fine.
No problem. Okay.
I'm
right.
sorry for the landscapers. There's nothing I can do.
That's okay, Monica. Actually, I haven't heard them, so not a problem. And we're
Okay.
almost, no worries.
Okay.
That's okay. I have my mind muted most of the time because my dog likes to bark at everything, including the butterflies going by outside. So, okay. All right. That's it for the agenda then. Agenda item I, does anybody have any announcements they would like to share? No. Guess we're all glad it's Friday. Yes, Jana, go right ahead.
Hi, everyone. I just wanted to let you all know that Raising Special Kids is celebrating, I think I mentioned this last time, our 45th anniversary coming up on April 26th. And we welcome any and all of you to join us because we are really, really excited just to celebrate the milestones of the organization and kind of share some exciting news for the future. And then also, I believe I mentioned earlier, we will be unveiling our new name as an organization at the celebration. So just wanted to share that and also share with you guys, we just did a professional development opportunity for our staff by Malia Dunn, and it was on microaggressions through our diversity, equity, and inclusion work group. And just wanted to say it was so well done and very just incredibly presented. Our staff received it so well and we learned so much from it. So if any of the other organizations on the call are ever interested, I just highly recommend her. She is a great facilitator and really helps you think about things in different ways and from a real curious lens. So just wanted to share that as well.
Thank you, Jana, and congrats on 45 years. Wow, that's pretty darn impressive. I don't know if you saw Vijette's comment. She'll be in town with another person and with Jade, and she's asking for more information.
Absolutely. I will send you the link and you guys come and celebrate with us.
Hey, that's exciting.
Yes.
And a new name, you and JJ, all new names. We have to learn to identify like forever. I'm like, oh, okay, all right. No worries, guys. Good job.
Jana, can you send the link to John so that we could send it out?
Absolutely. I can do
Thank
that.
you.
Jade is your kiddo. Thank you, Vijette. Thank you. I didn't know if that was a colleague or your child. So thanks for clarifying that. JJ, did you have anything to add?
No, just congratulations raising special kids. Hopefully we'll be able to send some staff so to celebrate with you all. So really excited. And yeah, I'm interested in that facilitator. We're always looking for staff development in our office. So if you wouldn't mind sending that contact over as well, Jana.
I'm happy to. Yeah, I can even send that one to John to share with the rest of the group too, if you'd like. And just as an announcement too, JJ, we have a Family's First Award that we're going to be presenting to one of your colleagues from your team for 2023. And I can already announce that that's Ronaldo Fowler. And we are just very delighted and excited to be able to celebrate him as well as some other recipients that evening. So
yeah, Chris sent me the message. I didn't know if it was like a to be announced type of thing, but yeah, obviously I'm sure you all know Ronaldo by, it's kind of like Madonna or Prince, right? They don't even need a last name.
right.
So no, I'm going to talk to him today about that and other things. I know he would be angry if I didn't mention the African American Conference, which although it's in June, it's never too early to start planning your schedules. So June 28th at the same Phoenix hotel, in case y'all haven't registered, or we're pushing out more and more information about that, but it should be great. And so if you do, when you see Ronaldo, you can let him know I did my job for, to announce the conference. So, and he's most deserving. I mean, I don't know how you all have been fighting a long time as well, but he just keeps going and keeps doing it. So I appreciate every year he comes back.
He's been around as long as I can remember.
Yeah, no, speaking of 40, I mean, he's been with our agency for 40 years. So even before we were Arizona Center for Disability Law, we were Arizona Center for Law and the Public Interest, and he's worked for us since the creation of the PNA. So,
wow, yeah, that's pretty impressive. He's kind of famous, infamous. Good guy.
both, depending on the day.
Yeah, 100% in there. Well, congrats on that. So, thank you. I just wanted to make a note and thank both JJ and Jana for their support. I had reached out to them on behalf of a friend of mine who's running, Gretchen Jacobs is running Senate Bill 1435, Ava's law, but that law is specific to but definitely tightening up the laws on school districts' responsibility for doing the background checking on their employees that they hire as paras. They're supposed to be doing their due diligence when they hire people as staff in general. But specific to paraprofessionals and people working with disabilities, they're supposed to reach out and talk to previous employers, because just running a background check isn't enough. You just have a background check. If somebody doesn't have any convictions, of course, they're not red flagged and nothing comes back. But if the districts would take the time in many cases to simply reach out to previous employers and ask questions, they would find out that there were difficulties with that staff member, with inappropriate behavior with children. And, you guys see the news just like I do. And unfortunately, I know some of those families personally whose children were sexually abused by paras that were hired to protect them. And if the districts had done their due diligence, which they're supposed to, those things most likely wouldn't have happened. You'd think that would be an easy slam dunk law to be passed. Of course, we want more accountability, but the governor's office, the legislators, they're all receiving a lot of pushbacks from the insurance companies for the school districts, as well as the lobbyists, Save Our Schools, SOS, those teacher unions. Nobody wants more responsibility, and it's kind of disgusting. So she's receiving a fight. So far, it has passed through both houses, but it has one more vote in the Senate, and then it will go on to the governor's office. And I know she met with the governor's office Wednesday, and trying to get staff on their side so that the bill is passed. So if you haven't signed in, where your opinion on that SB 1435. But thank you both Jana and JJ for being open for discussions on that and support. So.
Yeah, no, this is JJ. No, I appreciate you educating us on that bill. Obviously we don't have a full-time person monitoring all bills, so that we learn about these things sometimes through these channels. And so, we're looking out, but sometimes you all share. So thank you. Keep educating us on what's out there, and then reviewing it, being able to answer some follow-up questions. And then obviously with non-federal grants and our unrestricted funds, we're able to, advocate for our position. So yeah, that helps us know which bills are, and this is important. We're that's our mission, making sure folks are free from abuse and neglect, and those who are abusing and neglecting our children and our adults with disabilities, that they're held accountable. So I appreciate the partnership and the education, and keep sharing with us what's out there and what we might need to do. So I appreciate that.
Oh, I sure will. I sure will. And one last thing on that, I have to tell you, because it's not just a little oopsie, we just didn't do it. A very good friend of mine, their child was the catalyst for another, this is part of the reason for this piece of legislation. She was a child who was actually routinely abused for some time, nonverbal, at her high school. And when the parents, the only reason the person got caught is because the abuser took the child into a classroom during lunch period that was darkened, and he did not realize there was a teacher sitting at the back of the classroom. And that teacher immediately went to the office and reported. And when the principal called the family, the first thing he said to the parents when they walked in his office were, "We knew." And Dad said, what do you mean you knew? They knew. And all the ongoing stuff and investigations and legal actions families taking, they have found that both within that school and previous schools he was at, there were multiple victims, and had the district just done their homework, had they cared, it would have been prevented, and they couldn't be bothered. So thank you for this support. It is so important. Okay, guys, do we have any other announcements? Okay. I would ask for a call to the public, but I do not note any on our call today. All right. Thank you all so much for your time. We're going to get out of here about a half an hour early. Hallelujah. All right.
Okay.
Everybody have a wonderful
you.
weekend. Thank
Thank
you.
you, everyone.
You too.
Have a good weekend.
Thank
See you
you
next
all.
Friday.
Thank
Bye-bye.
you. Well,
Bye,
Bye-bye.
guys.
bye.
See ya. Bye. Hey, Mr.
Bye-bye.
John.
How's
Have
it
a good
going?
weekend. Yep. Are we good on everything?